Today I would like to give you a unique way and natural way to lower your blood pressure without taking medications that can harm you. Most medications we take today do have side effects. For example, cholesterol medication depletes you of vitamin D and coenzyme Q10. And if you have a low vitamin D status, your increased risk of death is markedly increased. So the natural way to lower blood pressure is to, number one, increase the curve of your spine from the side position, so increasing the curve of your low back, increasing the curve of your neck, will reduce spinal cord tension. The second thing we have to do is to analyze the markers for inflammation of your arteries. Most medical doctors will measure your LDL cholesterol and your HDL cholesterol. What the naturopathic physician will do, or the chiropractic physician, is he will analyze all the different types of cholesterol, including the small particle size and the large particle size. If you have more small particles, it's much more likely to clog up your artery. And also we measure the number of particles carrying the cholesterol. So, to review, the medical doctor will only measure HDL and LDL. There are a few who do the entire study though. We do what we call a complete study of all the different types of cholesterol, including the size of the cholesterol particle and how many particles are being carried. LDL particle number is a much higher predictor for heart disease than total LDL cholesterol. So once we analyze all that, if you have a high particle number, we may use things to lower your cholesterol as well as just like a medical doctor. But instead of using the drugs, we're going to use red yeast rice, for example, along with niacin, which is a B vitamin, along with omega-3 fats, fish oils, and other types of natural ingredients to replenish the vitamin D and the coenzyme Q10 you're losing from taking a statin medication. Cholesterol medications are definitely dangerous because they lower your cholesterol too low. Your cholesterol is important for preventing your arteries from breaking. If you have too low a cholesterol, below 130, 140, 150, then your increased risk for hemorrhagic stroke or the artery breaking is markedly increased. And all your hormones, steroid hormones, are made from cholesterol, including testosterone, including progesterone, including DHEA for the adrenal gland. By lowering the cholesterol too low, you're lowering your male hormone testosterone, and that's extremely important for heart function. So, the natural approach is to analyze your hormones. Bring up your testosterone if you need to take it up, which most men today are low in testosterone, even at a young age. Understanding how all the hormones relate together for the heart. Vitamin D, for example, is not really a vitamin, it is a hormone. It's made in your skin, it goes to your liver, then your kidney, and is transformed into its active form. Measuring vitamin D status is a very important thing to do. By getting good vitamin D status, it will lower your blood sugar, and most artery conditions are tied to high blood sugar. So, to reiterate and to summarize, for today, when you go to the doctor and he says, oh, your cholesterol is fine, did he measure your particle number? Did he measure the inflammatory factors for heart disease such as homocysteine or C-reactive protein? Did he measure how much clotting factors you have? So most people that have a heart attack or stroke, it's not because your artery keeps getting clogged up and clogged up and clogged up. Part of that plaque inside your arteries, which we all have, breaks off, forms a clot, creates a thrombus, and then you get a heart attack or stroke due to ischemia or lack of oxygen to the heart or to the brain. So what we do is measure the clotting factors, called fibrinogen, and some other factors. We measure the inflammatory factors, such as homocysteine or C-reactive protein, and we measure the LDL particle number and the size of the particles for LDL cholesterol, and then we compute your insulin resistance score. How much insulin do you have floating around in your bloodstream, as well as glucose? But number one thing we want to do is release spinal cord tension, because people who walk around like this, have a lot of tension on the brainstem, and your brainstem controls your heart rate and your breathing. When a sharpshooter wants to kill somebody, where does he shoot? Not through the cortex, the brainstem. So by positioning your head in gravity in a better position, absolutely will lower your blood pressure. Today I would like to talk about iodine. As you know, and have you heard in the news, that iodine and potassium iodide are used to protect you from radiation exposure. And we've all heard that all the health food stores across the country, have been sold out on iodine and iodide because we know it protects the thyroid from thyroid cancer. The problem is that you hear in the news that you can take too much iodine and that really you don't really need to take it. However, the health food stores are sold out. So what the truth of the matter is that the government does store potassium iodide in case of a dirty bomb attack, and they've done that for decades, right? But the naturopathic physician and the chiropractic physician and some medical doctors have been using iodine for at least 10 to 20 years for many things besides thyroid cancer. Iodine is extremely important for the thyroid function, but only 5 to 6% of the iodine in your body is in the thyroid. The breast tissue is another 5 to 6%. Your skin is 20% of the iodine in your body. Your muscles are almost 30%. There's 35% also in your fatty tissue. So iodine is used for many different parts of your body. In fact, most cells in your body have a receptor for iodine, just like for vitamin D. Iodine protects you from infection. It also protects the prostate from infection. If you have an infection, if you have a cut on your skin deep enough to require stitches, the doctors of today do not use betadine to heal or to disinfect the wound, because when they pull the stitches out, the scar tissue will not create a scar. In other words, it won't come together into a scar. Iodine prevents scar tissue from forming. So in today's world, if you get a deep cut and they sew you up, they're not going to use betadine, because when you pull the stitches apart, the scar will not form. By the same token, if you have fibrocystic breast disease and too much scar tissue in your breast, which is a precursor for breast cancer, iodine can protect you. In fact, if you're low on iodine, which most people are, the thyroid and the breast tissue will compete for iodine. They will compete together. So, and it'll probably go to the breast before it goes to the thyroid. So depending on your body status of iodine, it's used for many different things. In the test tube, they actually introduce iodine into what they call oat cell carcinoma of the lung. The most dangerous lung cancer you can get is called oat cell carcinoma. By growing the carcinoma on a petri dish and putting iodine in there, it kills the carcinoma. Iodine, of course, is used to kill the thyroid if you're hyperthyroid. They've attached radioactivity to it, and it will destroy your thyroid. So they use it to ablate the thyroid, or for the prostate, it's used to kill prostate cancer if they attach it to radioactive iodine. But we have iodine and iodide. Mostly in the thyroid, we use iodide. Mostly in the breast tissue, we use iodine. Mostly in the prostate, we use iodine. So the salt of the iodine is just a little bit different than iodine. We know that in the 1800s, the very first chemical used to kill disease was iodine. And it was used for many different types of problems. It wasn't just for thyroid cancer. So iodine can be measured by your excretion in the urine. That's the only true way to measure it. So what they do is they load your body with a lot of iodine, and the more you excrete, the better off you are. Because if you don't excrete most of the iodine you take in, that means your body really needs it. So you load your body with iodine, and then you do a urine test to see how well you're excreting it. You can't really do a blood test of iodine status. You have to be the urine test. But iodine is often, they call it in the medical world, they call it iodophobia. Because many doctors, in fact most doctors, are afraid to give you iodine. And they've been taught that too much iodine can cause all kinds of problems. But in reality, 90% of the population is low in iodine, just like 90% of the population is low in vitamin D. So, if you want to decrease your risk for breast cancer, prostate cancer, any type of infection, and your thyroid hypothyroidism, you have to get your iodine status up prior to taking thyroid hormone. So most women today are taking what they call Synthroid if they've been diagnosed with hypothyroidism. If your hair falls out, if you're gaining weight, if you're cold all the time, if you have excessive menstruation, bleed too much during menses, or if you have just a sluggish, depressed feeling, and also your hormones are low in the blood, they will tell you to take thyroid hormone. But they don't give you the active hormone, they give you the T4, which has to be converted to T3. T3 is the active hormone, T4 is Synthroid or thyroxine. Now, it requires iodine to make the active form thyroxine. But on the other hand, if you don't have good iodine status prior to taking these thyroid hormones, it increases your risk for breast cancer. So most of the women we see today, they're taking thyroid hormone, they're not taking iodine. They're increasing their risk for breast cancer by 100%. So if you're taking Synthroid, which is for hypothyroidism, you haven't taken iodine, you'd better rethink that and go to a naturopathic physician who will give you a combination of T4 and T3, the active hormone, and build up your iodine status prior to taking the hormone. Thank you very much.